So for those of you who've been at the Piedmont meeting, I apologize a little bit because you're going to see some of the same slides again, and also some of you may know that we have a little bit of a sparse attendance from our hand colleagues because one of our former hand surgeons is giving the Department of Surgery grand rounds today, so they split themselves up a little bit. So they send their apologies for not attending today. So Duke Orthopaedics was started by Alfred Shands was the first head of orthopedics at Duke. He started the group, the division in 1930. And although this quote is probably not original to him, he's been credited with saying, "Where there is no vision, the people perish." And he was talking about this when he started the Orthopedic Research and Education Foundation, which is the main fundraising group that raises funds for supporting orthopedic research in the United States. And since he came here, our department has sort of grown quite a bit in size from what it started out with in 1930. We've also changed a lot about the way we look. And in addition, we've also changed quite a bit the kinds of things that we do. So we've grown both in size and scope since 1930. But we've kept thinking about his original idea about a vision being important. And we went through a strategic planning process, and our goal of our department is to transform orthopedics beyond the cutting edge. And our vision is to be the global standard of excellence today and develop the leaders of tomorrow in orthopedics and rehabilitation, research, education, and patient care. And for us to do that as a department, it really focuses not so much on the things that happen from the leadership in the department, but the things that happen from the people who run the department, from our faculty. And in the past 16 months or so, we've actually recruited quite a number of faculty members. So I'm just going to introduce our new faculty members who have come in the last little while. Some of you may not know all of them because we've gotten pretty spread out as a department over the years. Justin Scruggs is a new physiatry faculty member who works primarily at Raleigh. Thorsten Seiler is one of our arthroplasty surgeons who works primarily here. Jonathan Rebo is a sports physician who works primarily out of this hospital. Kevin Spears, who was on our faculty years ago, has rejoined our faculty, and he works primarily out of Raleigh. Phil Horn is a spine surgeon who has joined our faculty, works primarily at Raleigh. Ned Amendola has joined the department as the head of our sports division. Courtney Carter is a researcher who focuses on understanding metabolism in mesenchymal cell differentiation, who joined earlier this year. Tim Sell came to be the head of our K-Lab. Janet Betcher joined our department from the School of Nursing to run our health policy and implementation research team. Gurpreet Bhatt has been embedded in the Duke Molecular Physiology Institute to work on metabolism and how things like obesity and diabetes change the way the muscular system works. Derek Coley has joined our doctoral physical therapy program, where he works primarily focusing on orthopedic education. Maggie Horn is a new faculty who's going to be joining, I believe, next month, who's focusing on international health services research in the DPT program. Corey Simons has joined the faculty, who's going to work on pain, physical therapy and pain and health policy, health promotion research. And Jeffrey Holder is coming in as one of the new doctoral physical therapy faculty who's working on orthopedic education in that faculty. We also have two new clinical faculty who are hopefully going to be starting in September. Up top is Greg Delarocca, who after quite a long search will hopefully be starting in September as our head of the trauma service. And Nora Foster, who's going to be joining the spine service, will be operating primarily out of Duke Regional Hospital. So we've had quite a number of recruits over the last little while, and that's actually continuing. Sometimes I feel like we're running a recruitment and career center. So over the next several years, we're going to be looking at additional spine non-operative and possibly operative individuals, new hand surgeon, arthroplasty surgeons, a third person to join our trauma service, possibly a peds surgeon, sports people to work primarily as we expand into Wake County, We're in the process of a search for a joint recruit with engineering. We're probably going to be starting the next year a search with the VA for someone who's going to do a focus on infection. We've actually started to, or actually for preventing infection, not to cause infection. We're working on a search at the moment for additional 1 or 2 people to help with hip preservation. We're going to start a search for a shoulder surgeon. And the doctoral physical therapy program is going to expand to include an occupational therapy program, so we need to search for a director for that. So we have quite a number of searches going on. Also, in the past, since January, we've had a number of people who have left the department. This is John Harrelson, who many of you have been around for years. Know he ran and actually really started the tumor service here, and he's retiring to his other passion, which is gardening. And so he's retired this year. Also, as many of you know, Bill Hardiker had passed away earlier this year, so he's left our active faculty. And we've had 3 people who have left the DPT faculty. Jan has retired. Andrea Taylor has moved to a position in Florida closer to her family. And Rob Butler took his dream job to be in charge of sports performance for the St. Louis Cardinals. So he's left academics for helping baseball players, I guess, pitch and hit balls better. So we're also reaching out to put the patient and their families at the center of all we do to provide the best quality care. And these are the heads of our clinical divisions and sections at the moment. And David Ateri in the corner, who's our vice chair for clinical activities. And this group has really done a fantastic job of really coordinating, providing exceptional care across really all aspects of orthopedics. I think we can really provide care that's as good as or better than available anywhere in the world in pretty much every aspect of orthopedics. Greg Delarocca is going to join us again in September to run the trauma service, and that also will be expanding. We're hopeful over the next year to a third faculty member, and also with some renewed research and education activities to it. We've also expanded the scope. This not only the quality and the expertise in the clinical areas, but also the size of what we're doing clinically. So this year we're actually on track to see about 150,000 patients in our outpatient orthopedic clinics, which is an increase of about 30% over what we had seen about 4 or 5 years ago. So that's a pretty big increase in what we're doing clinically. Part of that's related to new faculty coming in, but part of that is related to having same-day, next-day access, which is primarily located at our Page Road Clinic, which is pictured here. But we're going to expand over the next year to have same-day, next-day access here on the Duke campus at Sports Science Institute, and also towards setting up a same-day, next-day access site in Raleigh over the next year or so. And that will allow us to be able to really provide easy access to very high-quality care in orthopedics. We have many of our physicians who are consistently ranked among North Carolina's best doctors. Here are just a few of them that are listed from our faculty. I always have to point out that I'm not one of them, but we have many others in our faculty who are listed as one of North Carolina's best doctors. We also have people in our faculty who are doing some very novel, innovative things in terms of care. So we're doing 3D printed implants for replacing bone. That's a picture at the top there. We've been putting in some very novel new implants. This is a rod that's used for ankle fusions that has a thing called nitinol in the inside of it. And when it heats up at the body temperature, it compresses, so that you can use it to sort of improve fusion rates when using a rod like that. And we're using some new technology. Salim Parekh is at the bottom there using Google Glass to be able to teach what he's doing in India, back and forth from India to North America. So we're applying a number of different new technologies to what we're doing in terms of what's happening with our clinical activities. We've also, this year, will be officially opening the Sports Sciences Institute, although interestingly, it's already had its first year anniversary, despite the fact it hasn't been formally opened yet. We're really lucky to have both T. Mormon and Ned Amendola running the sports program, which has really expanded in both its breadth and its depth over the past year or so. And in a couple of weeks, I think June 10th, it's going to be formally opened as the Urbanic Sports Sciences Institute, and it's really been made possible by a great gift from the Scott family to be able to fund this. And naming it after Jim Urbanic is actually a pretty big deal because he remains an active faculty member, and it takes a major act of the Board of Trustees to be able to name a faculty building or something on campus after a sitting faculty member. So that's really a big tribute to Jim Urbanic. We've also changed the way the hand service is put together. So the hand service now crosses two departments. It includes both the Department of Surgery and the Division of Plastic Surgery, as well as the Department of Orthopaedics. Dave Roosh is leading that initiative to spearhead it and to make a more integrated unit. And if some of you may or may not know that the group did their first successful hand transplant last week. And although using experimental therapy for anti-rejection therapy as part of that, so far the patient's doing very well. And it's pretty exciting that they were able to get together as a team and work as a group and be able to make that a reality. We're also stepping up to serve and lead our local and global communities with integrity and compassion, and that's done to look at our communities and what's going on, not just globally, but also here. So we have people from our department who have gone over to Nepal to help with rehabilitation facilities after the earthquake, who've gone to Africa and South America and the Caribbean to help provide surgical care in areas that really don't have the access to the best technologies for providing orthopedic care. And here locally, we've had a number of initiatives, such as the Perry Initiative with Diane Little has really spearheaded, to try and get people who normally wouldn't be so interested in orthopedics as a specialty from high school up through medical school. To get them interested and to get them to think about things they may not have thought about as a career. We're also climbing higher to inspire through innovations in basic science, clinical and translation research. And we've made a lot of changes in the past year or so in how we've organized and how we're running our research enterprise. Our overall goal is to generate and use new knowledge to improve orthopedic healthcare worldwide. And we've organized our research group into 5 broad themes: cell genetics and developmental biology, musculoskeletal bioengineering, regeneration and repair, movement sciences, kinesiology and rehabilitation, clinical research, and populations, policy, and implementation research. And I'm just going to very quickly just show you the people who are in each of these groups and just tell you briefly about the kinds of things they're doing. So in our cell genetics and developmental biology group, we have a number of full-time researchers as well as clinician researchers who are working on trying to understand how fundamental things are regulated, the way cells work, how to make genetically modified mice, to be able to come up with trying to understand how things develop and how repair processes happen, and how pathologic processes like tumors happen, with an idea about developing new therapies, new drugs that could be used to target those. In musculoskeletal bioengineering, regeneration, and repair, I have a number of core faculty who are looking at things related to tissue engineering, how cells respond to mechanical environment, and how whole organisms whole parts of organisms like the knee joint respond to mechanics, as well as ways to prevent the development of the degeneration of these diseases like osteoarthritis. Ken Gall, who's sitting at the top there, is our newly appointed chair of mechanical and material science engineering at Duke, and he is coming in with a joint appointment to orthopedics as he's setting up a combined biomechanics facility, both involving orthopedics and the engineering school as part of this enterprise. And in this group, we've had a lot of people over the years who have collaborated with the other parts of these groups, and a number of clinicians have strong collaborations with the researchers in this group to try and bring a lot of these advances forward into clinical care. Movement sciences, kinesiology, and rehabilitation sciences is being spearheaded by Tim Sell, who we're able to recruit from the University of Pittsburgh to run the K-Lab. And in this research theme, in addition to the movement sciences, which has a lot of strong connections to sports and try to prevent injury. Also, there's a large effort with the doctoral physical therapy program to look at how we can apply high-level science to the way we use physical therapy and exercise interventions throughout a whole variety of different kinds of conditions. And in clinical research, I'm glad that we were finally able to recruit a head of clinical research. This was done with the Duke Clinical Research Institute. So Stephen George will be joining us in the fall. He's going to be the first head of musculoskeletal research at the Duke Clinical Research Institute and our vice chair of clinical research here in the department. And he has a focus on pain research in a very broad aspect. And he's very interested in how different things in the environment and population and genetics will influence your response to pain, as well as he's going to build a large group that will both be in the department as well as in the Duke Clinical Research Institute around focusing on musculoskeletal research from trying to understand populations to performing clinical trials. And then populations, policy, and implementation research. So you can do all these different kinds of research. You can try to identify new drugs that you might identify through understanding cell biology. You can build new biomaterials to get them into patients. You can test them out in a kinesiology or rehabilitation lab. You can do a clinical trial to show that it works, but you still need to be able to get people to use them, and you need to be able to get policymakers to say we should pay for them. And so really with the business school, with the Duke Clinical Research Institute, we put together a populations policy and implementation and research program. And we have three people who are really focused on this area. Janet Prubetcher, who I spoke about earlier, Chad Mathers, and Mike Landry. And just to give an example of the kinds of things that this group is doing and why it's going to be so important to us in the long term, Janet's done some work on the concept of using walking speed as a sixth vital sign. So some of you may know that your speed of walking actually correlates with your overall health. So a faster walker is a good thing than being a slower walker. And sometimes as your walking speed changes, it can be used as an indicator of when you're not as healthy for all sorts of different kind of activities. So along with Google, she's developed an app that can measure your walking speed. And the concept is that if you start to slow down, your cell phone will call up your primary care doctor and tell you it's time to come in for a checkup because you're slowing down and may not be as healthy and might need some kind of it might need somebody to help improve. There might be something going on that might need some intervention. And this has gotten a lot of news lately. This is from the News and Observer from 2 weeks ago, in which she was written up for using this kind of an app as a sixth vital sign to be used as a marker of health. So these are our research themes, and all of them have, as you can see, have connections between fundamental scientists as well as people in the clinical world who are doing related research. And again, going from very fundamental research to being able to actually practically apply these things in the real world. So how do you measure whether any of this research is working? Well, you can do it through traditional measures of things like grant funding, publications, and how many presentations that we've done. So this year, we've topped $7 million in grant funding. This is the largest we've ever had as a group for the department. And you can see there's a number of different researchers who have the funding. On the far side is the research funding that comes from companies, and they're primarily related to different kinds of clinical trials. And the closer side is funding from either federal agencies or foundations. So these are more open kind of peer-reviewed grants. So it's a fair bit of funding compared to what we've had in the past. We also have a lot of NIH funding. This year, we've topped $2.4 million in NIH funding. We're actually slightly lower than we were last year. As many of you know, Farsh Gilak he had a fair bit of funding. However, we really didn't drop all that much because some other people picked up some additional funding. And we have 4 faculty members who continue to have NIH funding. But Stephen George actually has a very large NIH-funded program. And when he comes here in September, we should really top $3 million. We've never reached that boundary before. And that would clearly put us in the top 5 for funding for orthopedic departments in the United States once we get to that level. And just to give you an idea about how this is our funding levels back in 2013 and 2014. And you can see we've gone from in the $4 million range to $7 million range in a relatively short period of time. So it's a pretty big increase in our funding And you'll see there's a much larger number of people who have research funding now than have research funding at that point in time. Remember, our goal is to generate and use new knowledge to improve healthcare worldwide. And research funding is fine. It's a little bit like stamp collecting. You have all this stuff, but it doesn't really do much unless you can do something with them. And one of the ways you can measure how we're influencing what's known worldwide is our publication rate. And we've had 206 publications from the department this year, including in some very prestigious journals, including New England Journal of Medicine, PNAS, and Nature Series journals. So that's a pretty good accomplishment for a department of our size. We've also had 326 presentations that our faculty members have made, including several that have been made by our faculty members who have given some named lectures. And we've had a stellar year at the American Academy of Orthopaedic Surgery. So Grant was telling me that today, 5 p.m. is a deadline for AAOS abstracts for next year. But this year, we've had 103 presentations at the American Academy of Orthopaedic Surgery, which is a new record for us since previously we really have hardly ever beat the 70s. We also this year had Lou DeFrade, who received the Kappa Delta Award. This is the second year in a row that someone from Duke has won the Kappa Delta Award. Last year, Steve Olson received that, and that's really a big honor that he was able to receive that award at this year's meeting. This is the Piedmont, our Alumni Association. This is we had a reception for them. So we had a very large reception. It's probably the largest attended Piedmont reception at the AOS meeting that we've had at least as long as Jim Urbanic could remember. So we had a pretty good showing at that event. And as some of you know, we had our Duke Orthopedic bus at the meeting, and this received quite a bit of press, including winding up on several other people's websites around the country. This is actually one of our alumni who practiced. One of our alumni who put his picture on his personal office website. But also our efforts there actually got mentioned both by the Cleveland Clinic and by the Mayo Clinic about both about the bus as well as about our blog we had going on during the meeting, and several of the other orthopedic departments, primarily University of Pittsburgh, have said that next year they're going to have to get 2 double-decker buses to beat Duke. We were thinking, since the next meeting is going to be in San Diego, we were thinking of getting a sailboat that says Duke Orthopedics on the sails. So we're also moving forward to promote and to develop excellence in education. And our educational program that's the largest, while a lot of people think about the orthopedic residency in the medical school, our doctoral physical therapy program is a very large educational program that we have now in the department. These are the students at their white coating ceremony from the DPT students from earlier in the year. And our doctoral physical therapy program has now been ranked number 10 in the country. So it's the first time in many years that the DPT program has reached the top 10 in rankings, which is it's a big step for them. Chad Cook was named the director of the DPT program. So as we look at the physical therapy program as involving occupational therapy, rehabilitation sciences, and other activities, Chad has stepped up to take over the head of the education program of DPT. And he's working on some new initiatives to re-engineer the curriculum, that's to improve satisfaction among the students and the faculty, and also to provide more efficient and effective education. And he's developed several new scholarships for qualified underrepresented minority students. And he's actually done that out of their own budget. So it's from the DPT faculty on their own have actually put the funds in to be able to make those new scholarships. On the clinical side, Brian Brigman and Fraser Leversedge have really led a re-engineering of what we're going to be doing in terms of our clinical orthopedic education. And as many of you know, there's many changes in what's happening in medical education. There's time constraints. It's very interesting, but we don't really know how we can measure competency in our trainees. And of course, these days, everyone does a fellowship. And one of the issues is, how do you look at residency education in the context of everybody doing a fellowship? What's the purpose of residency education? So as everyone's doing fellowships, people are doing more different kind of activities before they enter medical schools. Training is getting longer and longer and longer. And so we start off with some very innovative medical students who have great new ideas. They go through years of training, and then they become pretty senior by the time they're ready to go out and practice. And if you keep on adding extra years to the program, this just duration gets longer and longer and longer. So one of the concepts is, can you make training more efficient by shortening the time frame for some of those areas? And of course, Duke is a leader in this, in the way they've engineered the medical school curriculum to have really 3 years of core education and 1 year of independent scholarly activity, which is very different than many medical schools have. So we asked the question, can we shorten training over the entire continuum? Can you look at making the entire level of training from starting medical school to residency better or faster? And you can. This is the medical school curriculum. And you can see during that scholarly experience in the third, if you look at the curriculum, they have classroom for the first year, clinical rotation the second year, scholarly experience in the third year, and then clerkships in the fourth year. So could you take that third and fourth year and make it more focused on somebody going to orthopedics and maybe save a year in training? This is something that Bill Hardiker was very interested in doing for many years. And I think that, among other things, one of the strong tributes to him would be to continue this program going forward to make sure it gets implemented, to be able to come up with a program that really focuses on that focused core training. And so what we've done is we've taken the last 2 years of the medical school curriculum, and we've compressed it into a single year. And this is the overall curriculum that involves some orthopedic and some non-orthopedic activities at a variety of different locations, including at some of our community hospitals, to give them all the things that they would need for the requirement to finish medical school within that 1 year period. And then they would start the orthopedic residency training program after that. And this year, we selected our first 2 medical school students in the second year, Tim and Elshadeh, to begin their training in this program starting next year. So can we also focus our orthopedic residency training on what's needed for today's orthopedic surgeons? And this has been an issue that's been going on for a long time, as everyone's doing fellowships. Everyone's becoming a specialist. Ned Amendola and I did a survey a couple of years back at the AOA. 98% of people in residencies are doing fellowship training. So if you're going to be a spine surgeon, what do you really need to know about how to do an ACL, how to focus it, and what's needed today in orthopedic education in the areas everyone's being a specialist? And so we also are starting in July a revised curriculum in which we have our education in 2 phases. One is a general core competency that focuses on what you need to know no matter what specialty you're going to go into. So for instance, on a spine rotation, you learn everything you need to know to be a hand surgeon. On a hand rotation, you need to learn everything you need to know to be a spine surgeon. And then at the end, which will hopefully be the last 2 years or so of training, you can be more focused on what you're going to go into, including a general orthopedic stream at that point, to provide a more focused education for today. We also have had, over the past year, several other educational experiences. We've had the Emily Baird Reconstruction Symposium, which always is a very strong educational program, which Arthur Bolo and the Arthroplex team run. We've had David Little as our J. Leonard Golder visiting professor. And we've had Robert Peruca as our Atkins lecturer, as well as a number of other visiting lecturers in the specialty areas over the past year. So Duke has a very strong program in leadership, as well as a program in maintaining connections to our alumni. The Piedmont Orthopedic Society is probably one of the stronger alumni groups in orthopedics in the world. So it's a very, very strong group, one of the larger groups, with very large and active meeting every year of our alumni. And many of our members, both from the department here as well as our alumni, have gone on to various leadership positions. So almost all the North Carolina Orthopedic Association leadership team is either a member of our department or one of our alumni. And we have many of our department members who have leadership positions in Foot and Ankle Society, in sports medicine areas, in the Orthopedic Trauma Association, the American Board of Orthopedic Surgery, and the American Academy of Orthopedic Surgery, and ACUS, as well as other organizations. But our alumni have had a variety of leadership and awards new leadership positions and awards over the past year, including a variety of presidencies of many of the state organizations, receiving awards for excellent clinical activity, for becoming a faculty and chairs of orthopedics departments, becoming members of the board of the American Board of Orthopedic Surgery, doing work for the Secretary of State in Virginia to look at Certificate of Need, and winning various awards such as Legacy Awards and Ethics and the Elmer and Nix Award. So starting off here, our faculty, our trainees are continuing to have leadership roles sort of throughout their lifetime. So one of the other things that we've done over the past year is we've improved our web presence. So Tiffany Nichols has really helped to, sitting in the middle there, has helped to really build a new website, which includes a blog, what's new in orthopedics, as well as includes our grand rounds, which includes YouTube videos of all of our grand rounds, including this one. So this is a way that our alumni can keep up with what's going on in orthopedics at Duke, and it's an educational program that hopefully over the next year or so we'll also be able to give CME credits to as we're going forward. Lastly, Duke Orthopedics started in 1930. So in 2020, we're going to be 90 years old. So it's time really to celebrate the change that have happened over all that time. And we are planning some special activities for that year. And the current ideas are to plan something maybe around a football game weekend, where we'll have some activities here, bring our alumni back, and really celebrate 90 years of Duke Orthopedics. So when you think about the things we've accomplished and where our department's going, I really think about it being an academic footprint. Those are the kinds of things you can measure. Our publications, that's a surrogate really for what we're doing, where our trainees have gone off and the kinds of things they've gone on to do. If we've really improved clinical care for patients, and really to use the concept of using new knowledge to improve care. And I think we're on a good trajectory improving what we're doing in all those areas. And I think that going forward, we have a really bright future ahead for us and a big, strong global footprint. So I'd like to thank you for listening to the State of Orthopedics for this year. And I'm probably not going to be open for questions after this talk, but hopefully we'll have a really exciting year going forward. And I'm looking forward to really reporting on even more exciting things that our department has done this time next year. So thanks.